Association of American Colleges, Medical Colleges is pleased to welcome you to this webinar, Designing Your Pre-Med Journey with Resources from the AAMC. My name is Jennifer. It's my pleasure to facilitate. We did mute all participant audio. If you need help, send us a message. The presentation includes time for Q&A, and you may submit a question at any time by clicking the Q&A button at the bottom of your screen. Please note we will address your questions at the end of the presentation. It's now my pleasure to welcome Nia Brown and Kate Jackson from the AAMC. Ladies.
Thank you, Jennifer. Hi, everyone, and welcome to Designing Your Pre-Med Journey with Resources from the Association of American Medical Colleges. My name is Nia Brown, and I'm a Senior Communications Specialist here at the AAMC. And I'm presenting today with my colleague, Kate, who I'll pause so she can introduce herself.
Hi, everybody. My name is Kate. I'm also a Senior Communications and Outreach Specialist here at the AAMC. My work is focused on helping pre-med students like yourselves and advisors on their journey to medical school.
Perfect. Thanks, Kate. This presentation will cover some of the tools and resources available through the AAMC on your journey to medical school. We'll cover information about the MCAT exam, applying to medical school with the AMCAS program, financing your medical education, and much more. As you go through this presentation, please write down any questions you have and feel free to send them our way via the information found on the slide at the end of the presentation. You can also enter your questions as we go along in the Q&A box. The AAMC is a nonprofit organization that focuses on transforming healthcare in primary mission areas. Our mission is to lead and serve academic medicine to improve the health of people everywhere. The AAMC works through many different avenues to support and facilitate medical education, and one of those ways is by providing services and tools for pre-medical students, medical students, and residents. This tends to be a standard pathway to medical school, but remember there isn't a certain timeline or order that you must complete these requirements in. And here on the screen, you'll see our hub for the presentation today and all the resources that we'll cover. That will be anything from getting experience to preparing for the MCAT exam, choosing your medical schools, and applying using the AMCAS application. To get started, you'll need to work with your pre-health and or academic advisors to develop an academic program that meets your pre-medical and other school-specific degree requirements. If you don't have a pre-health advisor, the National Association of Advisors for the Health Professions, also called NAAHP, can connect you with one. To start your journey, we recommend signing up for the AAMC Pre-Med Navigator newsletter. This monthly newsletter provides information about important topics, resources, tips, and key dates for aspiring physicians. To subscribe and view all past articles of the Pre-Med Navigator, you can visit this link on the screen here. Another way to hear directly from our students is through our Aspiring Docs resource. Here you'll find information and inspiration to help you get started on your path to medicine. There are resources such as fact sheets, resource articles, and inspiring stories all included in this Aspiring Docs resource. The fact sheets are one of our most popular resources because they provide quick but thorough information about topics like shadowing a doctor, preparing for the MCAT exam, making the most of your gap year, and what it's like to see a patient for the first time. All of these resources can be found at the link on the screen. The Aspiring Docs blog features over 300 firsthand stories from pre-meds, medical students, and residents. You can search for posts by author, topic, or level of experience within the resource. And just so you know, Aspiring Docs is always accepting new writers. Writing for the blog is a great way to inspire others, as well as demonstrate one of the 17 pre-med competencies, written communication. Again, you can visit that link on the screen to learn a little bit more about Aspiring Docs. We want to do a quick feature here, and we'll do a couple of these throughout the presentation. Michaela was concerned about how her average MCAT score and one withdrawal on her transcript would affect her opportunities for admission to medical school. She tackled the withdrawal on her transcript head-on by addressing it in one of her secondary application essays. Michaela says, "It was reassuring to know that committees review applicants in a holistic manner. No applicant is defined by just one measure." In addition to your GPA and test scores, a lot of medical schools are progressing to competency-based admissions. This means that schools evaluate you based on your experiences, goals, and proficiency in the 17 pre-med competencies listed here on the screen. that demonstrate your preparedness for medical school. The pre-med competencies were updated in 2023 to reflect expectations for medical school. Medical schools will begin using these competencies in the 2024-2025 application cycle to evaluate applicants' readiness for medical school. Many applicants wonder, what is a competency and how do you demonstrate it? After hearing those questions from applicants and pre-health advisors, we created the Anatomy of an Applicant website. It defines these 17 pre-med competencies that medical schools look for in applicants and gives you tools and examples for how to develop those competencies. On the next slide, you'll learn a little bit more about that resource. So like I mentioned, to show how successful applicants have demonstrated these competencies, we interviewed real medical students, their pre-health advisors, and the admission officers who accepted them. On the Anatomy of an Applicant website, you're able to read stories from medical students and how they demonstrated the pre-med competencies during their path to medical school and in their medical school applications. You'll also get the perspectives of their pre-health advisors and the admission officers who accepted them. In addition, you'll find information about the parts of the application, and you can complete a workbook with self-assessment worksheets, which help you identify which of your competencies you'll need to work on. To access that, simply navigate to the link on the screen here. Some people have questioned whether shadowing a doctor is necessary to become a competitive applicant. Shadowing is a valuable experience because it exposes you to patient care in a clinical setting and provides insight into the day-to-day demands of a medical career. While shadowing can provide you with exposure to the patient care environment, it's not the only way to demonstrate these skills and characteristics. Here are a few other ways to gain medically related experience. If you're looking for a program that will prepare you for health profession schools, you should strongly consider the Summer Health Professions Education Program, better known as SHPEP. This free summer program has strengthened students' academic proficiency and career development for over 30 years. Funded by the Robert Wood Johnson Foundation, SHPEP is a free 6-week transformative program for college students. The program provides opportunities to explore a variety of health careers, including dentistry, medicine, nursing, optometry, pharmacy, physical therapy, and public health. Furthermore, the program prepares scholars for successful applications to health profession schools. Over 65% of SHPEP scholars who apply to medical or dental school are accepted, and over 78% of alums obtain advanced degrees, demonstrating the success of this program. Hosted at several universities across the U.S., SHPEP provides students with a comprehensive academic enrichment experience. This includes coursework in the basic sciences and math, clinical experiences, career development activities, learning and study skills seminars, and financial planning workshops. The program aims to enhance access to information and resources for college students, offering a variety of fun and enriching academic and career experiences. SHPEP is open to college freshmen, sophomores, and juniors with a strong interest in pursuing a career in the health professions. Eligible applicants must be U.S. citizens, permanent residents, or individuals who have been granted deferred action for childhood arrivals or DACA status. Additionally, applicants should have completed 60 or fewer credits and college credits and maintain a GPA of at least 2.8. The application process requires a personal statement and one letter of recommendation. For more information, please visit shpep.org. Many students recognize the importance of gaining practical experience in the health field through various activities such as volunteer work, shadowing, laboratory work, and working as a medical scribe. These experiences are invaluable for those pursuing careers in medicine and healthcare. Here are some specific ways to gain medically related experience. As a hospice volunteer, you would provide compassionate care and support to patients and their families during end-of-life stages. As a certified nursing assistant or CNA, you would assist nurses with patient care, gaining direct patient interaction and hands-on experience. When you volunteer as an EMT, you'll be responding to emergency situations, offering immediate care and transportation to medical facilities. If you choose to work as a hospital scribe, you would work alongside physicians to document patient encounters, learn more about medical procedures and patient care. And you could also work as a caretaker, who would provide daily care and support to individuals with chronic illnesses or disabilities, enhancing your understanding of patient needs. You can explore these and other summer enrichment opportunities by visiting the website link on the screen. When you're ready to apply to medical school, you'll see that the application process encompasses a lot of different things, from choosing which schools to apply to, preparing for the MCAT exam, deciding if the preview exam is right for you, filling out your medical school applications, and covering expenses related to the application process. The process of applying to medical school has a financial component. AMCAS, MCAT, MSAR, and other items do have a cost associated with them, but the AAMC firmly believes that the cost of applying to medical school should not deter you from becoming a doctor. So we created the AAMC Fee Assistance Program. Before registering for your MCAT exam, preview exam, or applying to medical school, we strongly encourage you to explore the AAMC's Fee Assistance Program. This program assists those who, without financial assistance, would be unable to take the MCAT exam, apply to medical schools with the AMCAS application, or use some other AAMC resources. Please note that the benefits of this program are not retroactive, and you will need to apply before using any of these benefits. There are a number of benefits with the fee assistance program, and they include reduced MCAT fees, reduced preview exam fees, free MCAT prep materials, free subscription to the MSAR, a waiver of the cost of the AMCAS application and AMCAS fees for up to 20 medical school designations, and a discount on your AIRS application when you get into medical school. Additionally, if you're planning to apply for MCAT testing accommodations, you'll have access to a stipend for an updated psychoeducational or medical evaluation if necessary. If you were to use all of the benefits available to you with the Fee Assistance Program Award, you would save more than $2,000. So it's definitely worth investigating to see if you're eligible for this program. Speaking of eligibility, to be eligible for the Fee Assistance Program, you must have a US-based home address. Approval for the Fee Assistance Program is tied directly to the U.S. Department of Health and Human Services poverty level guidelines. So parental and financial information and supporting tax documentation are required for applicants under the age of 26, and you must be preparing to apply to medical school. It's free to apply to this program, so we encourage you to do so. For more information, head over to aamc.org/fee-assistance to review the website and take a look at the Fee Assistance Program Essentials to determine your eligibility and get answers to your questions. Okay, switching gears a little bit, we're going to talk more about the MCAT exam and then following the preview exam. So the MCAT exam is a standardized computer-based multiple choice exam taken at a testing center. All US and many Canadian medical schools require MCAT scores for regular admission to medical school. The exam tests you on the knowledge and required skills medical school students, faculty, and residents have identified as key prerequisites for success in medical school and the practice of medicine. The exam specifically assesses your problem solving and critical thinking skills, as well as your knowledge of scientific concepts and principles necessary to the study of medicine. We'll take a quick look at Nadia. By trying to save on the cost of MCAT prep materials, Nadia Scott decided to self-study from used MCAT review books and ultimately took the exam unprepared. In the end, Nadia knew she did not study appropriately for the MCAT exam. In retrospect, Nadia would have financially invested in appropriate MCAT prep materials since the exam score is a vital component on medical school applications. She's quoted as saying, "Instead of trying to save on costs, I would have invested in the appropriate MCAT prep material. If I had to prepare for the MCAT exam again, I'd completely revamp my study technique to incorporate practice questions to assess my strengths and weaknesses and flashcards for repetition of the material." The content on the MCAT exam is divided into 4 multiple choice sections. There is no writing section on the exam. Those 4 sections include 2 natural sciences sections, a behavioral and social sciences section, and a critical analysis section. The sections test content found in introductory biology, physics, psychology, and sociology courses, in addition to introductory general and organic chemistry and first semester biochemistry courses. The exam takes about 7.5 hours to complete, which includes everything from checking out to taking breaks. MCAT exam scores are released 30 to 35 days after you take your exam. You'll receive 5 scores, 4 individual section scores, and 1 total score. Your section scores will be added together to create that total score. The ranges of each section and the total scores are listed here on the screen. So you may be asking yourself, when is the right time to take the MCAT exam? And the answer is when you're ready. Here are a few questions to think about to help you determine when you might be ready to take that exam. When do you want to apply to medical school? Many examinees take their MCAT exam in the same year that they're also applying to medical school. The next question is, are you familiar with MCAT content? Do you understand it and do you feel comfortable with that content? The MCAT exam doesn't have any required courses you'll need to take before registering or taking the exam. But if you feel you need more time to prepare based on what's tested on the exam, you may want to consider a date later in the testing year. And that last question is, will you need to retake the exam? No one really likes to think about retaking the exam, but if you think you will need to test more than once during a calendar year, you want to think about making your first attempt earlier in the year. This will allow you time to receive your scores, decide on whether to retest or not, and then find an available testing seat later in the year. As a note, the testing season does run from January to September, with the exception of the month of February. A few other things you might want to keep in mind as you're thinking about when is the right time for you to take your exam. There are a limited number of times that you can take the exam. In a single testing year, you're only permitted to take the exam 3 times. Over 2 consecutive testing years, you can only test 4 times. And in a lifetime, you're permitted to take the exam a total of 7 times. In your preparation, it's important to use effective study strategies and to build a study plan. The AAMC has free resources to help you do this. We have a free guide that will help you develop a study plan and incorporate study strategies. This resource is available online and as a download. It can also be helpful to see how others tackle the exam. Be sure to check out tips for medical students on our website and also through our MCAT prep playlist on YouTube. And be sure to check out all of our other resources and practice products to help you throughout this process. Here you can see some of the resources that the AAMC makes available either free or at low cost. These include study resources such as the Khan Academy MCAT video collection and review questions, practice questions, full-length exams, and inspiring stories. Now I'm going to hand things over to Kate, who will talk about preview and some other items as well.
Hi, everyone. Just so you're all aware, I have been putting links in the chat as we've been discussing them, and I will continue to do so. So moving on to preview, medical students and doctors must understand far more than chemistry and basic human anatomy in order to provide better care for patients. They'll need to provide truly compassionate care that nurtures your patient's mind and body, as well as collaborate effectively with multidisciplinary medical teams, and you'll need to navigate emotional, cultural, and ethical challenges with resiliency. So the AAMC designed the Preview Professional Readiness exam to look beyond the standard academic metrics in order to assess core personal skills such as resilience, service orientation, ethics, and teamwork. When this is combined with other parts of the admissions process, preview scores provide medical school staff with a more complete view of you as an applicant. So the preview exam itself is designed to measure your understanding of effective professional behaviors across 9 of the AAMC's core competencies for entering medical students, which is represented here in this image. The preview score is an evaluation for these competencies. The exam does not tell us how exactly you'll respond in a specific context, but rather it gives us information about the extent to which you know which behaviors are effective or ineffective. It reflects someone's potential or their capacity to learn and develop in these competency areas, which is a necessary precursor to engaging in effective behavior. The preview exam itself takes approximately 75 minutes to complete, and it offers the convenience of testing at a private location of your choosing, such as your home, while maintaining a high level of security with live remote human proctoring. There is a flat fee for the preview exam. This includes unlimited score distribution to participating schools. Examinees who are approved to receive benefits from the AAMC Fee Assistance Program will have this fee waived. So please visit our website to see what schools use preview in their admissions process. We also have information on how participating schools use those preview scores in their admissions process, and how they will be shown on the MSAR, our Medical School Admissions Requirements profile, as well as our AMCAS, American Medical College Application Service application. The preview exam will be offered for 7 testing windows, beginning in April and will be concluding in October. Score reports will be released approximately 30 days following each testing window, and you will receive your scores on the same day that they are released to schools. The preview exam also provides students with free prep, the preview program also provides students with free prep resources, which include an examinee prep guide as well as a practice exam booklet. The prep guide provides preparation advice and strategies for completing the preview exam. Our practice exam booklet includes 2 full-length practice exams with scoring key and rationales for all items. This is intended to help examinees become familiar with the format of the exam, the types of scenarios that are used to evaluate the understanding of the competencies, and process for evaluating responses. We encourage you to review the Prepare for the AAMC Preview Exam guide page to locate these resources and check this page regularly for updates to our suite of preview prep materials. So now we're going to move on to explore our accommodations process. The AAMC is committed to providing all individuals with opportunities to demonstrate the proficiency on the MCAT and preview exams, and that includes ensuring access to persons with disabilities in accordance with relevant law. So if you are a student who has a disability or a medical condition that you believe requires an adjustment to standard testing conditions, we encourage you to apply for testing accommodations. There's a lot of good information on the MCAT and preview pages around application timeframes and types, as well as application requirements and what to do once you receive these decisions. A decision on most initial accommodations applications will be made within 60 days of receipt of a complete application. Instructions for applying and links to the application system, as well as any updates to the programs, can be found on the MCAT and preview web pages. If you have questions, I do encourage you to go to the email at the bottom of this slide. We've also put it in the chat. All right, another story. So, like many applicants, Rose worried about not having a perfect grade point average or particularly high MCAT score. But she said, during my interviews, no one asked me about my unbalanced MCAT score or the C grades in my transcript. They were more interested in learning about my strengths and the strategies that I used for overcoming challenges. So, her advice for applicants is to choose schools with missions that align with your own. Her school is focused on rural, underserved communities, and that's what resonated for her. So every medical school is different, and on average, applicants will apply to about 17 medical schools. But with so many different programs to choose from, it can be difficult to determine where to apply. So keep in mind that just like every applicant is different and has their own story and experiences, each medical school is different and has its own mission and culture. You can view the medical school's mission statement and a ton of other relevant information for free within the AAMC Medical School Admissions Requirements, the MSAR, which describes the medical school's teaching philosophy, their core values, and what they're looking for in their applicants. It can be helpful to think about what you're looking for in terms of your own goals and your values, and asking yourself, do these align with the medical schools? The medical school admissions requirements resources help you to prepare for the application process as well as choosing where to apply. So when you get to the point where you're making your decisions about where to apply, it can be very tempting to focus only on academic requirements and medical school statistics. But remember, this is where you're going to spend at least 4 years of your life, and so there's a lot of factors that you're going to want to consider. So using our MSAR tool, you can search your schools by location, median MCAT score or GPA, and then review school-specific data. You can save and rank your favorites. You can save notes on each school, as well as review pre-med coursework. Those who subscribe can view complete school data, including things like student data, volunteer experiences, and you can even compare medical schools side by side. The official guide to medical school admissions is a chapter guidebook that outlines the admissions process, but it also highlights other things like medical career options, how to prepare for medical school, what medical students study, and how admissions decisions are made. So we recommend looking into this resource early in your process in order to help you get a handle on what's involved and develop your own application timeline. This also includes access to PDF worksheets too, and you can find this and all other MSAR resources online at the link on the screen. Okay, so now you've taken your prereqs, you've gotten your experience, and you're ready to apply using the AMCAS system, as well as plan how to pay for medical school. So here is what you will need to know. Our AMCAS program is a little like the Common App that many of you may have used to get to apply to college. So you're going to be using just one application. The AMCAS program will verify and process your submitted application and then send it to your designated medical schools electronically. The AMCAS program also distributes your letters of recommendation, your letters of evaluation and your MCAT scores directly to the medical schools. So here, just take a look at this typical application timeline. This is what we refer to as the AMCAS application cycle. The AMCAS cycle is 1 year ahead of the current calendar year. And it's offset like this because the application cycle corresponds to when you hope to start medical school. The AMCAS cycle starts in May of every year. Medical schools will not begin receiving processed applications until late June. Once your processed application is sent, medical schools begin the review process, which usually involves secondary applications and in-person interviews. So keep in mind that medical school admissions are rolling, so submitting your materials earlier rather than later is a good idea. You'll need to keep track of your medical school's AMCAS application deadlines, as this is the date your application needs to be submitted by. Official transcripts must be received by the AMCAS program within 14 calendar days from a medical school deadline. These deadlines are detailed in the medical school section of the application as well as on our website. The information requested of you in the AMCAS application is relatively straightforward. However, it is very detailed, so know that completing your AMCAS application will take time. All right, so the AMCAS application itself has 9 sections, which are listed here. And again, it asks for a range of information about yourself. Some of these sections are very self-explanatory, but we've highlighted some in green to require a bit more time and thought. The coursework section, right there in the center on the bottom, you'll enter every college level course that you have attempted or completed. An official transcript is required for each post-secondary institution in the US and Canada. Also, requesting an official transcript for yourself will be very helpful for you when completing this section. Moving along, the work and activities section, which is right there in the center, is designed to give you the opportunity to highlight your work experience, your extracurricular activities, awards, honors, or publications. You can add up to 15 entries in this section, and you can select up to 3 experiences as your most meaningful, which you will then be asked to reflect on in writing. Your personal comments essay or your personal statement, which is on the right in the center, will also take some time to draft and finalize. This is an important part of the application process because it's really your first chance to convey to medical schools why medicine for you. But remember, there's not a formula for your essay or a right way to craft it. It needs to be unique to you and your story. We do have guides and video tutorials on our website. We also have a YouTube channel, an applicant guide, and lots of FAQs to help you navigate the application. We also have a fantastic contact center who are available to answer your questions about the AMCAS program, as well as MCAT and preview. The AAMC strongly recommends becoming familiar with our first program, the Financial Information Resources, Services, and Tools. First can equip you with tools, tips, and information that will help you to borrow wisely, and when it comes time, help you to repay your student loans responsibly. First can help you understand the financial aid process, can help you manage your finances during medical school, and also gives you the opportunity to learn about loan repayment options. Some of the things you'll find when you visit first are our fact sheets. These are short articles that are cover sometimes difficult to understand topics. You'll also find videos and webinars that overview of ways to pay for medical school and how to repay your federal student loans. You'll also find resources from FIRST, which include repayment charts, timeline, budget worksheets, and tip cards. And there's also a tool called the MedLoans Organizer and Calculator, which lets you organize your student loans and run various repayment scenarios. One of the ways to help minimize your financial stress is to learn as much as possible about student aid and funding options. So using our FIRST homepage, you'll want to use the Search FIRST button. This is a separate search tool from the main website. So we've highlighted it here in an orange box. That is the search tool that you will use when you're specifically looking for FIRST resources. You can search by audience, like pre-med or resident. You can search by topic like financial aid, managing money, and you can even use your own word search. So in addition to all the helpful financial aid information that you'll find with our first program, you'll also find our financial wellness program. This is a financial literacy program that provides information that we all need to know as consumers about various financial topics like budgeting, credit, taxes, insurance, and a lot more. We also want to mention that there's many different paths that you can take once you get to medical school, including MD, PhD programs. So physicians and physician scientists both go through training in medical school, and they both have biomedical knowledge, but physician scientists serve to bridge scientific research and clinical patient care by advancing biomedical knowledge through research. So the goal of MD, PhD programs are to prepare trainees for a career that combines research and clinical care with an emphasis on research. Most MD PhD programs provide trainees with a stipend and tuition scholarships. This financial support recognizes the time that a student must spend in training for the MD PhD career. The extent of financial support varies among programs and may only support US citizens and permanent residents. The curriculum integrates both MD and PhD training, with many PhDs are possible. There are non-traditional PhD training opportunities like economic, healthcare policy, and more. So there are many different places that you can get information that will help you help support you on your pathway to medical school, and we'll go over some of those now. So the AAMC is supporting all aspiring physicians and their advisors by switching to digitally focused channels. So we've created our Premed resources webpage. This is one of our most useful digital tools for you. This Premed resources collection includes various links throughout our student and residence hub, which is our website, for easy navigation, as well as print-friendly handouts of items that we would normally distribute at our Premed events. This page is designed to mirror the applying to medical school journey to help make it more accessible to applicants like you, as well as your advisors. The AAMC has the Integrated Learner Services, which is also called ILS. This supports the evolving goals and needs of the medical students we encounter by creating valuable connections. So ILS hosts a group of nearly 200 students on the AAMC Learner Feedback Panel, who then participate in engagement activities where they are invited to share their individual journey into medicine. So if you or someone you know is interested in participating in ILS engagement activities, please feel free to contact using the email on the screen there. So all of the resources that Naya and I mentioned today are on our student and resident website. This website is a really great starting point no matter what phase of your journey you're in. You can always search for information or use the menu to navigate to topics you want to learn more about by visiting aamc.org/students. We do have some additional upcoming webinars that I want to inform you about. The next one that we have coming up is on March 20th. This is being held by the Preview team. This is a webinar that is for any medical school applicant who wants to learn more about the Preview exam, what it tests, how to know if you should take it, when to schedule the exam, and the resources available to help prepare and get ready for test day. Further, for those who are closer to taking their Preview exam, the Preview Prep team will also be holding a webinar with step-by-step instructions on how to prepare for the exam and the free AAMC resources available to help you on April 8th at 2 p.m. There are QR codes on the screen, so I'm going to leave this up a little bit longer to see if maybe we want to take that down. But Naya is also putting the registration links into the chat. Finally, we do have an upcoming webinar for AMCAS. This webinar will help prepare applicants like you for the 2026 AMCAS application cycle. So attendees will receive a walkthrough of the AMCAS application, learn what's new in the application, and the available AMCAS application resources from the AAMC. Again, Naya has put those links in the chat if you are unable to use the QR code at the moment. So again, we did give you quite a few links. So I really strongly encourage you to get your phone out or take a screenshot to get all of these web addresses. in case you didn't have time to jot them down. This has all of our websites in one place that we spoke about today. So please take note of this. So as we're wrapping up this presentation, I strongly encourage you to reach out to us, follow us on Facebook and X, is where we give a lot of information as well as tools, tips, and quick answers to your questions. And please visit the AAMC student website for all of the resources that we mentioned in today's presentation. Thank you for your attention. We will now open it up to questions.
Before we hop into questions, I just want to note that we did put the link for our upcoming Premed webinars page in the chat as well. We just added an additional AMCAS webinar to that page, so you'll be able to see that information on that page. And you can also navigate to the registration links for all of the webinars that Kate mentioned from that page as well. All right, we'll go ahead and start answering some questions in the Q&A. If you all want to continue to add questions, please feel free to do so. Our first question is, you mentioned that if you don't have a pre-health advisor at your school, you can find one at NAAHP.org. What if you do have a pre-health advisor, but they have not been very helpful? Could you utilize this resource, or is it just for students who don't have an advisor at all? You can still utilize NAAHP.org. There are a lot of resources that are available for students, both with pre-health advisors and without pre-health advisors. We do just like to note that that is an alternative if your school doesn't have a pre-health advisor, because we do know that a lot of students don't have that resource at all. So you can still use it. Okay. And then we had a question, is the SHPEP, or is there a similar program to SHPEP that graduate students can apply to? You can visit services.aamc.org/summer programs for more programs available to individuals, and we can put that in the chat as well. Let me just.
I can pop that in, Naya.
Okay. Oh, I just got it in. Okay. And then is there a way to transfer data from AMCAS to TMDSOS or AACO-MAS?
Well, as far as I know, there is not, but you can manually enter that information. So perhaps you could put it all in a Word document so you can copy and paste. Are there any additional questions for us?
I think those were the bulk of our questions from the audience at the moment, but we're happy to answer anything else that has come up while you all have been listening to either Kate or I or the questions.
I do know many students do tend to wonder about when is the right time for them to take the MCAT exam. And though Naya and I did, Naya covered it today, I just want you to know that it's when you feel ready, when you've prepared. And that's a question that only you can answer for yourself, in case any of you are wondering. It's a very personal question, so you know how you study, you know how you prepare. It's one of those things that you'll have to answer for yourself, but the AAMC has a plethora of resources to help you on this journey. So please look at the pages that we've shared in the chat here.
Yeah, and we've shared a lot of feature links in the chat. So some of them are not clickable, but we've shortened a lot of our links for accessibility for everyone. So you might want to copy some of those if you haven't taken them down or taken a screenshot of the last slide or the resource slide that Kate showed, as all of these links won't be accessible to you all after we end the session today. But you will get a resource sheet with, a little bit more information.
Looks like we did get some questions. Is there a limit on the amount of times you can take the preview exam? In a year, you can take it 2 times. Total amount is 4. I do encourage you to look at our website, AAMC.org/preview. There you can get a list of what schools do require or recommend the preview exam.
We did get a question about MCAT. How do we know that all, or how do you know what all of the AAMC MCAT resources there are? Oh, okay. So all of our AAMC available resources for preparing for the MCAT exam are available on, I'm just trying to grab the link for you all. the Prepare for the MCAT exam page. So there is a list of free planning and study resources, a list of low-cost products, and they're separated out here on this page that I'm dropping into the chat for you all. And there's lists on both of those. So those are all of those resources that I mentioned, as well as some additional question sets and things like that.
I see one. When is the right time to take preview? And is there an ideal time before applying? Oh, did it just move for me? Oh, yeah. When is the right time to take preview? Is there an ideal time before applying? So it's sort of similar to the MCAT exam where you want to take it when you're ready. But a lot of students do tend to take their preview exam around um, May of their application cycle year. Again, you can look on the preview website to see what prep materials we have to go over those. Like I said, we do have practice exams for both MCAT and preview that are free. So I strongly encourage you to utilize those. Those will give you a much better understanding of what the actual exam itself will be like. Nye and I both said it to students before to set yourself up for success by taking those practice exams under the same conditions you'd be taking the actual exams. That'll give you a good idea of what it'll be like the day of. So you'll really be in a better position if you do that.
Here's a follow-up preview question, Kate. Do you need to have your official preview scores before submitting your application?
So schools will receive your scores at the same time that you do. So once you've gone through that process, everybody's going to get them on the same exact day. So it's not something that you'd be doing separately.
We also had a question about scholarships and resources available to non-US students or citizens. We have mentioned a lot of resources that are specific to US citizens, but the first program that Kate mentioned has a lot of opportunities for students both within the US as well as outside of the US. So we can put that link back in the chat just to make sure that everyone has it. And that program features grants and scholarships and loans and a number of different financial resources that you could look into and take advantage of.
Just in case there were some questions today that we are unable to get to, I'm happy to put my email in the chat and have you reach out to me directly. And if I don't have the answer, I can put you in touch with the right person who does.
And a link to the recording will be sent to everyone following this session. It'll also be available on our website at the Premed resources, so aamc.org/Premed Resources Hub. All of our recorded webinars from all of our sessions are available there for you all to watch.
I was just going to say the links that we've mentioned, they're going to be in that last slide. So when you get the recording, it's not like a copy and paste. You'll have to type it in yourself, but the links are in the presentation itself. And again, I just put my email in the chat. So if you would like to reach out to me, I can send them to you that way as well.
We have a question. Does the AAMC have any training and development resources for pre-health or pre-med advisors within a university to assist in their ability to help future prospective pre-medical students?
We do have resources. I can put the link to that pre-health advisor webpage, but I also encourage you strongly to sign up for our pre-health advisor newsletter that goes out the second Wednesday of every month. I can put that link in the chat as well. That email will have information about any upcoming webinars that we'll be holding, things that are opening for registration like MCAT or preview, fee assistance, AMCAS. There's also information in there that's relevant for you to share with your students about things that ways they can interact with the AAMC. So it should be very helpful for advisors. Let me get that link in the chat for you. We do actually have one upcoming webinar for pre-health advisors for preview. If you would like to reach out to me directly via email, I can send you that link as well.
And then we have, I think, what is our final question for so far? Is the timeline for AMCAS submissions the same as AACOM? I am not 100% sure about that, but you can find that information on the aacom.org website. They also have an applying to medical school session or section specific for osteopathic medicine. And then I guess if there are no other questions, and Kate, if there's no other information you want to share, we can go ahead and turn it back over to Jennifer.
Sure. Wonderful.
Thank you so much, everyone.
Great, thank you. And please do give us your feedback on today's session by filling out the evaluation that will pop up on your screen as soon as we end. As we mentioned, we recorded this session. We'll email you once it's ready. On behalf of the AAMC, have a great day.